Welcome to Normal Reloaded, a series of panel discussions that aim to visualize life in the COVID-19 induced new normal. There's one thing we've learned across India after living in a lockdown state for 43 days. It is that we have to coexist with the virus at least until an effective vaccine is discovered and mass produced. It's also been a time where many of us have displayed a trait that's common in our societies, the inability to confront bad news and prepare for eventualities around COVID-19. What's needed now more than ever before is not to panic and have a clear picture of what to do. Today's panel discussion will look at what you really need to know about COVID-19 symptoms and how to respond. I'm delighted to introduce the panel to you. We have with us Dr. P. Srinivasan. He's Technical Director, Neuberg Diagnostics, one of the first private labs to get approval from ICMR for testing in 4 Indian cities. Thank you for joining us, Dr. Srinivasan.
Thank you.
With him, we have Dr. Srikanth Padmanabhan. He's Consultant Emergency Medicine at Apollo Hospitals, one of the world's largest hospital chains. Thank you for joining us, Dr. Srikanth.
Thank you for having me too.
And joining them is Kishore Manohar. He's Director, Apollo Shine Foundation, a not-for-profit initiative by Apollo Hospitals Group that focuses on campus health across 100 campuses and covers close to 2 lakh students. Great you could join us, Kishore.
Thank you. Thank you so much, Ashwin, for having me here.
So I think I'm going to start this discussion with the obvious question. What do you think we all need to know about COVID symptoms and how do we respond? I'll point this question to Kishore. I know there are parts of this question that both our other panelists can also weigh in on. So I'll leave it to Kishore to loop them in. Over to you, Kishore.
Thanks, Ashwin. Actually, I'm probably the least qualified on this panel here, so I will defer to Dr. Srinivasan and Dr. Srikanth. Just that, running the Apollo Shine Foundation, we look after a whole bunch of student members, about 1.75 lakh of them. And we have been facing a lot of queries from concerned parents, from schools, on what to do, what next to do, and I found myself answering these quite frequently. So we decided to come together and put out a small advisory on what are the different scenarios out there and what needs to be done in each case. That's what started off this little presentation that I put out there. Maybe Ashwin, could you share that on the screen?
Yeah, I'm just going to get that on, Kishore. Yeah. Keep speaking, yeah.
So what this basically does is break down people into different categories of symptoms that you have and then advise on the way forward for each particular case. I will, of course, defer to Dr. Srinivasan and Dr. Srikanth at the right points in that presentation because they are the experts. The first category, of course, the most important set of people are the people who have isolated themselves and have followed all principles of self-isolation. These are people who have stayed at home, stayed safe, sanitized, not stepped out unless absolutely necessary. They have no symptoms. I think they're quite fine. These are model citizens, if I may call them that. And power to them. They are the ones who should be sharing their stories with the others on how to stay at home for 53 days. It's very tough for all of us. But yeah, that is quite a commendable effort. They are probably at the lowest risk in the pyramid of COVID. The next would be the ones who have a risk of COVID, which I would classify as people who have traveled, who have some travel history and exposure risk. By travel history, I'm not referring only to interstate or national travel. I think that has been now locked down for quite some time. But even within their community, within their neighborhoods, if people have been stepping out a lot, going to stores to pick up urgent supplies, or going to work for unavoidable reasons, I think they are a risk category. And I think people who are in the healthcare segment and volunteers particularly, there are a lot of people out there doing a lot of good work, stepping out, doing things for the underprivileged in society. All of these, however, are a risk category. I think they need to watch their symptoms very carefully. They definitely need to take care of all the norms mentioned in terms of hand washing, preventive measures, and social distancing, going home and staying away from their immediate family till they sanitize themselves. And of course, watching out for symptoms, because that brings us to the third category of people who are symptomatic, which we say people who have a fever or a cough, to err on the side of safety. It's not that all other diseases. There's a cute little meme on the internet of a person fishing, a person lying down reading a book, someone just relaxing over there in an armchair, and the headline is other diseases while COVID is at work. It's not the case. There are other diseases. People can still get the flu. You can still get a cough. But to err on the side of safety, if you find yourself symptomatic, I think you need to call a doctor or reach out to someone in your neighborhood, in your circle, and let them tell you what your status is instead of panicking. The doctor is the one person who can tell you whether you need to get yourself tested and what you need to do. This, in fact, will lead to the doctor giving you his advisory or giving you a prescription, which you can then take to the nearest lab facility. Dr. Srinivasan, is that right? Can you take it from here?
Fair enough. Fair enough.
What we're saying is from the point there the doctor gives a prescription, they then come to the lab.
That's right. Okay. Now, there are, of course, when you have to get it tested, because if you are symptomatic, and I know that most of the consultations today happen on WhatsApp and FaceTime and whatever you call it, use the technology, and you started getting your prescriptions on WhatsApp, and that you transfer to the lab and lab prints out or whatever it is. But there has been a lot of noise on the testing. We started with saying that we are not testing enough, so that's why we are not seeing the numbers. And when we started testing more, I have to commend here the way in which the testing is going on, contact tracing is going on in Tamil Nadu is something commendable. Because I do interact with these people at the corporation level and the government level, and the control room that is working. I think it's a tremendous work that's going on. I only wish this continues post-COVID to improve the public healthcare delivery system. That will be a phenomenal change. Now, coming back to the testing. So, if a test is absolutely required, and they, of course, they come in with the prescription, and of course, they need an ID card, because for the simple reason that if it's positive, there is a need to get in touch with you by the public health authorities to ensure that what risk you pose to your own immediate surroundings, the street and the neighborhood. So do you need a quarantine? Because the concept of quarantine is now changing every day. It's an evolving. By the time we completely evolve the process, I only wish the hype on COVID disappears. So that is something is what you need is a prescription, and you need ID card for your testing. And the testing process is something pretty simple, that we need to take a swab, which generally is sort of putting in just imagine the earbud that you have, probably 1/5 of that size, which gets into through the nose, and we just leave it there for about 30 seconds, take it out. The assumption here is that the fluid which is there in your respiratory tract, in the nostril, the nasopharyngeal region that we talk about, either a throat or the thing, the virus is there, and the swab is going to have a representative sample, mark the word representative sample, for the virus. But we do know, when we test by what we call, it's like when HIV came up, HIV and ELISA became synonymous. Now with this virus around now, the RT-PCR and COVID has become synonymous. So it is, I used to say that when it is water, we talk one brand. When we talk Dalda, of course, Vanaspati, we talk something. That's become a way of talking now. So when you get the test result, one needs to understand and remember, people keep asking, how long this test is valid? The test is valid for the day that you took the test.
Very true.
Not after that.
Right.
It's very simple. I may be negative today. I can just pick it up tomorrow, because what other thing about this virus is your ability to catch it, or the ability of the virus to touch you and go. So one need to remember the validity of the test results for the day on which we do the test. And also the second point with reference to testing is that the test can still be negative in somebody with a suspected or a symptomatic COVID within quotes. The reason
Right.
is that the representative sample that we take from the nasopharyngeal region is positive only in 60 to 70% of patients with proven COVID by testing other forms of fluids or as pharyngeal swabs or lavage
Correct.
swabs, fluids and all those things. I'm sure Dr. Srikanth will touch upon that. So two important things in testing. One, it is valid for the day on which you test. Please remember
Right.
that, because it has a lot of implication on the amount of testing that is going on what I call the pre-boarding testing, pre-delivery testing, pre-surgical testing, and all those things. So
Right.
second thing is that there is only 60 to 70% of patients with COVID are test positive by this methodology because of the representative sample. Three, I just want to touch upon a little bit on the statistics. From 25th March, when we were permitted to do the test, till today we have done close to around 7,800 tests, of which less than 2% is positive.
This
And
is Neuberg Diagnostics.
that is
Neuberg.
right. I'm only talking about Neuberg.
Right.
Okay.
7,800 tests, less than 2.5% is positive, and over 95% of them are asymptomatic.
Right.
So here is something, a disease which we are made so much of hype about, is completely asymptomatic. It is prevalent like any other flu in the community. And there is a lot more to talk about on this. I'll just leave it for the time being, and
Sure,
then
Doctor.
maybe take it up later on.
Right. So, Dr. Srinivasan, what happens once the test has come out positive? Does the lab inform, or is it the government that informs the people?
No, there are two things. It's mandatory that the lab informs the government, either positive or negative. We need to
Right.
inform. Okay, on the lighter side, we have become very good clerks, because we need to key in 3 different portals. Apart from our own portal, we need to key in one the government of Tamil Nadu wants, and the one which the ICMR wants. So we need
ICMR.
to capture, key in physically the same data in the technology driven world 3 times, and wasting that much of time when it can be grabbed in a second from one source to the other source. So when the result is ready, the result is shared with the government and then with the patient, because after all, you can't say that I will share only with the government, because people start talking about rights now, because I pay for the test, I have a right to have the result. Now, who gets the result first? That's the whole question. The government says that if you give it to the people, if it's a positive, you may not be able to trace, they may be hiding. Where can they hide in the situation of a lockup? So lockdown rather, not lockup. The lockup is the next step. So the patient, the client, I won't use the word patient, the client gets the result instantaneously. Once it's ready, it reaches by email. That's why we insist on an email. And of course, the government gets at the same moment, and the government comes to the person's home and then takes care of the next steps.
Okay. Thank you so much, Doctor. I think the next step is then where the government comes to their home and offers you a choice of either a private hospital or a government hospital.
Government hospital.
And one of the things I think Dr. Srikanth will be able to tell us is what should people do from that point? How do they prepare going into the hospital? And what is the procedure in the hospital? Dr. Srikanth, once they find out that they are COVID positive and they've been referred to a hospital, what happens next?
Okay, so once they've been diagnosed as COVID positive, so like you said, the government offers private and government hospital setups. So I work in a private hospital, so I know significantly more about how it works in a private setup, but I do know what happens in the government setup too. So right now, majority of people prefer to stay in the government setups. Yeah? And the three major medical college hospitals that accept COVID patients in the city that I work in, Chennai, are nearly full. And the government has identified locations outside hospitals, say colleges that are not medical colleges.
Yes.
Also, the trade centers where you have a large number of cubicles and other similar areas where people who are COVID positive, but they don't need medical care per se, say the asymptomatic people or the people who have very mild symptoms, say low-grade fever or just sniffles and coughs, can go and actually safely quarantine themselves there. So we have a significant number of these patients actually being quarantined in such centers right now. So only those people who need hospitalization are offered beds in hospitals. And I can tell you that this number is very, very small. Like Dr. Srinivasan said, out of those who test positive, 95% are asymptomatic. And out of the symptomatic ones, 95% of them have only mild symptoms. So like he said, among the ones who tested positive at Neuberg, only 2% are symptomatic, right? And among this 2%, 95% have only mild symptoms. So they would go to a hospital and stay in a ward for a specific amount of time until they become asymptomatic and they test COVID negative. So right now the government has changed the policy to say they just stay for a certain amount of time, and it does not matter that they test COVID negative or not later. So even if you don't test COVID negative, you are discharged and you stay at home and self-quarantine yourself. So only 5% of those who require hospitalization then turn out to be very sick and they need intensive care. And even among those who need intensive care, again, only a very small number of people require ventilation, mechanical ventilation per se. And it is this group of people where the prognosis is very, very, let us say, frightening. And this requirement of ventilatory care is what the public health systems all over the world fear will overwhelm the system, like it happened in Italy, where they did not anticipate such a huge influx of patients who will require intensive care and ventilatory care. So this is where the lockdown and the preparations for testing and the jacking up of the overall availability of beds in the government and in the private system, and also the availability of ventilators have been jacked up, like we heard in the news all over. So the government is specifically focusing on making PPE available for the healthcare system and making beds and ventilators available for the healthcare system. So I think in one way the lockdown has helped the country, though it has not helped the country in many ways. One way it has helped is that we have been able to jack up the capability, the capacity to offer care for people who need hospitalization and people who need intensive care, and also the people who need ventilators ultimately. So when the lockdown began, the number of ventilatory care beds that were available in the country were about 50,000, and now we've at least by official statistics, we have improved the availability of ventilators to about 2 lakhs all over the country. That is really is phenomenal. And to look at it, people with COVID-19 who are on ventilatory care right now is still in the thousands. And we have 2 lakh beds that can accept people with ventilatory care. So when the patient enters the hospital, if that is what you want to know, you should expect a lot of rules and regulations on who can visit. So we don't want people spreading the virus, and people putting their own family and also others at risk. So there's a lot of restriction on who can visit, which is causing a lot of distress to the patients right now. A lot of restriction on who can actually enter the hospital itself. If you see, most hospitals have separate fever clinics and separate buildings and separate areas where these COVID patients are being treated, because it is so contagious. So a lot of restrictions. You should be prepared to see a lot of people in very advanced PPE. So people wearing over full gowns, masks, shields,
Yes.
and so on. So it might look frightening to the patient. But again, they must understand that it is not all these safety measures are not just to safeguard the healthcare worker. It is also to safeguard the patients themselves. So when a patient who goes to Neuberg lab or to a hospital with cough and cold, they might not actually have COVID-19. But if the healthcare worker there is not being careful, is not wearing his PPE, then he might actually be a point of spread to people who are actually not affected. So the PPEs are there to safeguard the healthcare worker and the person who comes seeking medical care also. So this is one thing that people are offended about, the restriction on the visitors and the fact that everybody appears to be wearing full suits, even though some of them might actually test COVID negative. The other thing is, in the people who are being quarantined, but they are not very symptomatic and they don't need uh, hardcore healthcare facilities. The people who are being quarantined at colleges, schools, and in World Trade Center and so on. So these people should expect to be there for at least 2 weeks. So these people are going to be kept there, and they are going to be attended to in terms of food, other amenities, and not medically. So they should expect to be there for about 2 weeks until they are completely asymptomatic, and then they
Right.
would be led back to go home again. So this is what overall people should expect.
I think that's really good, because I think this what you brought out. People are used to a particular type of hospitalization. They're mentally prepared for that. They can visualize it. And thank you, doctor, for actually sharing how this process of being admitted in a hospital can be quite different. So actually, we're running out of time. So what I'd like each of the participants to do, I think the key thing is, what is your one message for the public? Because like I said, I think what we are realizing is that we should be aware. At the same time, there's no need to panic, and do sensible things. But are there any messages, a key message from each one of you? I'll start with Dr. Srinivasan.
Yeah, I think we need to understand this is like one more flu that we have seen in the past. We have to learn to live with it. In a simple sort of an example, if I have to say, you cannot stop a river that is flowing. You can slow it, you can sort of divert it, but it is going to be with you forever. And this is one example of the thing that we need to live with COVID. We treat it as one more flu that we have seen, we have survived, and we have learned to live with it. The time we stop talking about numbers, red and green and orange, I think the life will come back to normal, and people will get the immunity, and we'll be over on top of it.
Thanks, doctor. I think that obsession with numbers, everyone seems to be on top of these numbers every day. Like, you ask them about inflation numbers
So
or
true.
anything, but they're so obsessed with these numbers, understandably. But I think you brought a really great point. Let's go to Dr. Srikanth. What's your one message that you'd like to share?
My one message is, like Dr. Srinivasan said, we are only trying to delay dramatic spread and not trying to actually stop the spread per se. So I would request everyone to wash their hands very frequently as part of their personal hygiene. Wear a mask whenever they would go to a public place, both nose and the mouth, and stick to social distancing. So I would ask them to avoid all kinds of crowds. So this is not a good time to go to a movie or to a mall or to any place that is very crowded. So this is the major message I would like to give to people.
Thank you, doctor. And Kishore, also when you're sharing, you could also let people know, because I think where to go for how-tos and authentic medical information if people want.
Yeah, definitely. The one thing I want to say is, since the doctors have spoken about the medical side, is to liken this to the world famous road accident stat. Everyone talks about how road accidents have reduced in India. But one thing we need to understand is that road accidents are a part of our life. I have some stats in front of me which say that in 2018, 1.5 lakh people died in road accidents in India. That is 2.3% more than the number of people who died in 2017. We didn't stop going on the roads. We didn't ban cars and bikes. There are people selling helmets. We don't call them profiteers. Government provides advisory. We tell our loved ones to take care. We ride our vehicles. We wear seatbelts. We wear our helmets, and we go about our work. I think that is the way forward, to take it in our stride, follow the necessary precautions, and look after the people around us and share information. To your point, Ashwin, about information, I have been looking at 3 sites. One is the CDC, one is WHO, and of course, the site I use the most often is the Ministry of Health and Welfare, which pretty much has all the information that's happening in the government and rules and regulations that industries, institutions, and people need to follow. These are all useful sites to go, and I think together this is we can definitely beat this. Till we,
No,
like Dr. Srinivasan says, it becomes another form of the flu.
Yeah, I think that's really great. Some of the points that we brought forth. I know that this is a tough discussion to do in a very short time because there'll be a lot of ground to cover. But I think we've covered some of the key apprehensions and things that people have in their mind. And the overreaching message seems to be one: be cautious, but don't be paranoid. I think that's for me seems to be the message. Of course, we need, like Dr. Srikanth was saying, take those simple precautions, but there's no need to obsess with this and, let it, become this sort of a negative obsession in our minds. And I think on that positive note that we can definitely overcome this, just like we have overcome many things in the past. I'd like to thank each one of you, Dr. Srinivasan, Dr. Srikanth, and Kishore, for taking time off and being with us on this panel discussion.
Thank you, Ashwin.
Thank you very much.
Thanks, Ashwin. Thanks for having us.
Bye-bye.